Hi everybody, my name is Taylor Green. I'm one of the audiologists here at Audiology Associates. This is the last video I am by myself, guys. It's my last solo video for a little while, I believe. Reese is going to be coming back on the next video for you. So we've got two patients in this compilation. Again, neither of them are mine. The first one you're looking at here, this is Reese's patient, and the second patient in the compilation then is Katie's. Now, this is a very deep kind of plug of what looks like keratin rather than wax. You can see there's almost like long, thin kind of strips around the outside, which are still attached to the ear canal. It's a very tricky consistency to maneuver because it can be quite brittle, which you just seen there. There was like a little piece that broke off this plug. Now I can see Reese is going around the edges. He's trying to see how mobile this blockage is. There we are. He's got a good grip there now. So hopefully that's going to bring out the whole plug in one go. It's where we've got to maneuver the ear canal, or you've got to get past all those little bends. You can almost see at the entrance of the ear canal there's a lot of dry, flaky skin, which again could be a sign of eczema, possibly psoriasis. Can't really be 100% on it, but again, it's usual telltale signs that this is something that is sort of causing this sort of build-up. Very, very dry, very, very crumbly. Now there was a little bit on the other side there, but it was obviously really firmly attached and pretty solid. So Reese has just advised, generally like myself, I assume would have advised a little bit of oil going down the line. Same thing here though, just detaching this plug from the ear canal. You can see there's a lot of loose hair as well, just kind of stuck in the little bits further on into the ear canal. But generally coming out okay so far. It's not really giving much of a fight. Because again, these ones, especially with eczema, if it is caused by eczema, can be a pain. You normally see a lot of puffiness, a lot of swollen, inflamed ear canals, because it's just so itchy. It's really, really, it gets to some patients, and I can understand it, because I mean, I might not be as bad as obviously what an eczema patient would be like, but I've had the occasional itch in my ear, and it just makes you want to scratch it off. So this is Katie's patient. Oh gosh, this kind of similar to Reese's patient. Again, looks like a load of dry skin, but just all scattered and just completely filling this ear canal up. Katie's done the right thing here. She's gone straight in with the olive oil, which I probably would have as well, looking at how dry that was. There's trying to, oh, there it is. I was going to say there's a little bit of a lift there now. And you can see just how stretchy this is. So again, this is a load of dead skin that's accumulated in the ear canal. I may have mentioned it on one of our previous videos, but this is something, if a patient has generally had problems with the skin building up, skin we find generally tends to build up quicker than wax. So the patients that have skin conditions, they generally tend to need more regular appointments, so like coming every 3 months. Which, you know, some people do say, you know, having wax removal, is that going to cause the ear to kind of, you know, build up more? Personally, I don't think that is a case. I mean, there's a load of different conditions that can cause the wax to build up quicker. It can be hereditary. So I mean, we've seen a lot of people in their sort of, well, 20s, teens, that you know, we see it like this, and it can be a hereditary condition where it just builds up a lot quicker. But then again, you get a lot of patients who have really narrow ear canals, like we've already mentioned a few times on this video, you know, eczema, skin conditions. I've seen patients with sort of dermatitis that again has problems with skin building up inside the ears. Katie's doing a good job here. it's a deep one as well. It's got a bit of oil on the camera there now, so we're going to clean that away. There you go. Yeah, I was just going to say, peel that bit off the side of the ear canal there now, just to give yourself a little bit more room. Vision tends to be a little bit better as well. You can start seeing more space, and you can start seeing around the sides as to where your next attempt is going to be. The oil generally tends to work quite well with this type of skin, because it does allow you to get a slightly better grip, which is, it's not really going to soften it up on the appointment day, but like I said, it allows us to get a better grip, because it can slightly sorry, get my words out, it may slightly change the consistency of, you know, what we're trying to remove. God, this is not an easy one to do though. I'm going to throw it in there now, guys. Don't forget, if you do enjoy these types of videos, and you know you're one of those people like us who really enjoy doing it, and you like to see all this being done, don't forget to like and share. You know, follow the pages, whichever platform you're watching us on. You know, we enjoy having everybody on board. You know, we do try to keep up with the messages. There's a lot of messages that we get coming through on these videos every day. So, you know, it's difficult for us to keep on top of it, but we do now have a few of the girls at the front that are more kind of monitoring some of the messages and questions that you're sending in. So, yeah, drop us a follow. It doesn't cost you anything, and we would appreciate it. I think Katie's just tried to pop a little bit more oil in now that we've got to this deeper section. Yeah, you always tend to find these deeper sections that are close to the eardrum. They tend to be a lot harder, because if the patient has been using some oil, some patients will book an appointment and will be quite lucky to get an appointment either on the day or in a day or two's time. So we sometimes advise like 3 to 4 days worth of olive oil just to try and soften it up enough to remove it easier. But in some cases it's just not possible. I mean, we see them on the day sometimes. They've popped a little bit of oil in, but it's just not enough to soften it to get a decent grip, because that dry, solid kind of skin is very difficult to get a grip of. So Katie's done well to get that bit out there. How much have we got left here? Yeah, a couple of scattered little bits now, so this should be the easier of the pieces to remove. Still have to be careful because we're right in front of the eardrum here. That's it. Get a better view, that's it. Yeah, get a good grip there now. Try and lift that up. Try and peel that away. I spoke too soon there. I didn't realise how attached this one was going to be. There, you can see just behind there, it's starting to like lift. It's starting to pull. Yeah, what Katie's done there is something that I would tend to do occasionally as well. If I can see it's not lifting, I will try and grip the piece that's above, because that can sometimes roll it forwards. And you do sometimes get a little bit lucky, but it's not going anywhere at the moment. There it is. That's the grip you wanted. Oh, piece obviously broke off. Yep. See, it's like multiple colours on these plugs that are coming out. The darker pieces tend to be really old, dry, solid wax. The lighter pieces then, like the yellow, the white, that tends to be the dead skin. So exactly the same on this side here now. Katie's gone in with the oil straight away. A little bit of a wiggle now just to try and loosen this up. This does look a little bit more mobile than the other side, so this one might come out a little bit easier. Oh, Katie's gone in with a hook here now. that is the Rosen insert that I believe. Could be the right hook. No, I think that's more the right hook. Yeah, I can see what Katie's doing. She's trying to get that grip from the top, because you've probably seen, if you watched quite a few of our videos, you've probably seen occasionally where once you nip over the top of that plug, you can sometimes get a really good grip and it'll just roll out of the ear canal, and it's really satisfying when it happens. But again, this is, you can see on the bottom of the ear canal there, this is still really attached. So Katie's repositioned with the suction. She's gone back in with the hook here now. Oh, it just needs to go that little bit further if possible. There it is. Oh. It's very tight though, and it's a very tricky one to pull through, especially when it's really brittle. There's that little gap. Yep, I was going to say, just to that top left there's that gap. There we are. That's starting to roll through quite nicely now. Yeah, a bit more space in this one. I don't think there's going to be much left down by the eardrum, because I think this was just in front. I might be wrong. It's the first time I've watched this video myself. But going from the gap that I just saw appearing above that wax, above that skin. Oh, look how dry that is. Dry as a bone. There we are. Little pull here now. There's the next bit. Oh, trying to pick it up. The amount of times me and Reese, and Katie's probably done it once or twice as well, have dropped the wax onto the patient's lap as we're taking it out of the ear. Whoa, there's a big piece. Look at that one. Yeah, lovely. You can see already before going in, there's a little bit of irritation there, and that could have just been where all this dry skin was attached to the ear canal. But wow, oh, there's a couple of little tiny gaps there. But yeah, we've got about 7.5 centimeters worth there. I know it's got 8 there, but there's a big gap before that last one. Yeah, that's a pretty decent amount from those 2 ear canals, and fair play, Katie's done a good job there. Well, thank you as always, guys, for watching the videos. It does, it does really, we do appreciate every single one of you. You will see myself and Reese, I believe, on the next video. I don't know if that's going to be members or a normal subscribers video, but take care of yourselves, and we shall see you on the next video. Thanks, everyone. Bye-bye.